We're back. Listen to this. Last year, Americans spent more than $12 billion, that is with a B, billion dollars on cosmetic procedures. We're going to talk about that, and we're going to sit down and talk about the hottest procedures we should avoid and some that are safer alternatives. And we're doing that with board-certified plastic surgeon Dr. Anthony Youn. Welcome, doctor.
Thank you.
By the way, did a nice job out in the
yes,
singing.
Very, very impressive.
If I can have a singing doctor, that's what I'm going to go with.
As he can, but
Yeah, you brought it home.
All right, what are some of the most popular procedures that women look at?
So the most
these days?
popular procedures for women, according to the Aesthetic Society last year, were breast augmentation, liposuction, and tummy tucks.
Okay.
And for men, and men only make up 10% of patients who have plastic surgery, but more and more men are having it done every year. Surgery-wise, liposuction, eyelid lifts, and nose jobs.
Okay.
Well, let's start with some of the procedures that are hot right now. And I understand, and this is new, I haven't heard of this before, but stem cell augmentation. Is that replacing the gels, the implants?
Yes. So the idea behind stem cell breast augmentation, I mean, it sounds futuristic. Basically what it is taking fat, supercharging it with stem cells, and injecting it into the breasts. And the idea is instead of using an implant, you can make the breast larger using your own fat. But the problem is that 1 out of 9 women will get breast cancer in their lifetime. And so any procedure we do to the breast, we need to prove that it doesn't increase the risk of breast cancer, it doesn't delay the diagnosis or interfere with mammography screening. And it hasn't been proven not to do that.
Are you using other people's stem cells or your own?
No, it's only your own.
Okay.
Yeah, so you can actually take stem cells from your own fat.
Right.
They supercharge then the fat with those added stem cells.
And is the recovery time, are the benefits on that side of it? I mean, that seems like a big negative. I would say let's not do that if it could.
Well, actually, I think the idea theoretically is a good one. I mean, the idea of stem cells is their cells are so young that whatever you put them into, they become that organ. And that's the idea behind organ, people who have, let's say, cancer and you're trying to reconstruct organs. But the problem is what if a woman has an occult breast cancer? They have a breast cancer you don't know about, and you're injecting stem cells around it. Is it going to cause that breast cancer to maybe be worse? So it's all about safety. So nowadays, the most popular procedure are breast implants. And so I tell patients stem cell breast augmentation is a future, but it's not necessarily the present.
Okay.
And today we've got a couple of different kinds of implants, and I can pass these off to you if you'd like. This is a cohesive gel silicone implant. About 80% of women who have breast augmentation use these. And now we even have...
This has been around, doctor, for a while.
It has been around for quite a few, actually probably about 15 years or so.
Okay.
But they're still the workhorse in breast implant surgery. But now we have the gummy bear implant.
What?
The gummy bear implant. Now, I'll let you feel that. Now, it's not an actual gummy bear, obviously, but it's a solid silicone. So initially, we started with liquid silicone in the 80s and 90s. This is a silicone gel, and now we've gone to the actual solid silicone. So it does not leak. And so the fear that women have of, oh, no, these silicone implants are going to leak and make me sick, they just don't.
Okay, but now we're still talking about women and breast cancer, though. I mean, you have this. If you implant this in you, isn't it harder to find the breast cancer cells when you have implants?
There have actually been studies, thousands and thousands of women, that actually show that it does not interfere with tracking down breast cancer. It doesn't delay the diagnosis of breast cancer, or it doesn't limit your options. Strangely enough, women who have breast implants actually have a lower risk, lower incidence of breast cancer than women without implants.
Really?
But I think it's probably because most women with implants, they take care of themselves. You know, they're going to put the money into their appearance. They're also going to take care of themselves, too.
I see a needle. I don't like them, but I'm going to ask anyway. These are fillers you're talking about.
Yeah, so there are doctors across the country who are doing fillers to inject into the cheeks, into the lips, into the buttocks, and they're using permanent substances like silicone. And that's what I consider a big no-no. So the idea behind...
For real? Like real silicone?
So there's two things. So real silicone, if it's medical grade, can cause problems down the line.
What kind of problem?
Well, I call it the gift that keeps on giving. You can get infections, you can get scar tissue, you can get inflammation years down the line, even if it looks good today. And even worse, there are people who aren't even doctors who are injecting industrial-strength liquid silicone to people.
Oh.
Yeah, that's
silicone caulk.
Is that legal?
No, it is not, and people have actually died from it. And you may think that it's just on the coast or it's in big cities, but it's actually in the heartland, too. I've seen patients who've had this type of thing injected into all parts of their bodies, not knowing that it's dangerous.
Well, doesn't it move, too? I've seen some women who've had fillers, and they end up looking like, first of all, pillow faces, because there's no dimension to their face. And I see it moves sometimes, and it gets wrinkly. Can that be removed or fixed?
Well, that's the good thing about the newest filler today, and that's called Voluma, and this is FDA approved for actually filling in the cheeks. As we get older, our cheeks, we lose volume, we get kind of gaunt, we get a little chiseled looking. It's FDA approved for filling the cheeks, lasts up to 2 years, so it's not permanent, but it lasts a long time. And the best thing about it is there's an antidote to it. I can inject something into the face. It takes literally seconds, and it dissolves it away if you don't like it.
Really?
Yeah. So
I like
that's
that.
what I recommend.
For the lips?
Yeah, this you don't do for the lips. The lips, you want to use something a little bit different.
You know, everything you say perfect, but it's scary because I saw now a lot of my neighbors that they injected something on the lips and they look like they can suck an orange across this room.
Duck lips. They're called duck lips.
The trout pout.
The trout pout.
Like they had two chorizos in the mouth, you know, good morning to everybody. But plastic surgery, it is in. I got nothing against plastic surgery. Please don't misconstrue me, okay? But what I try to say is that it's terrible to live with a defect or terrible to live with a complex. So yes, if you have something that you don't like, change it.
Yeah.
But make sure that you have a good doctor. Otherwise, you're not going to like it yourself.
Char, what did you say before to us about the implants or attitude? What is that?
Well, listen, I'm scared. Like you said, because the bigger enemy for women now is the breast, cancer in the breast. So I have two choices, to put one of those things here, or just do exercise, mirror on the wall, make my maracas 44, and attitude.
That's all.
I guess you can't argue with
it
that.
Was the attitude. What did you say about something with the attitude? That's what I was. What?
I think
I think we're going to go from the breasts to the butts.
Yes.
It's called the perfect segue. Let's bring it down.
Yeah, let's go. What do we have in the end there?
Okay, so last year there was a 58% increase in the people having buttock enhancement, believe it or not. From 2012 to 2013, 58% more people had buttock enhancement. There are two ways to do it, and this is one I don't recommend. This is a buttock implant, and I know you want to feel this.
I haven't. Yes, you know me and a great butt. But there's a video online on YouTube about this woman that had a butt implant, and she takes this and turns it all the way around in her butt cheek. I mean,
why? Why do people want big butts?
First of all, it shouldn't be moving, number one.
Exactly.
Right?
So that's the danger of buttock implants, is they get infected, they can get displaced. And can you imagine sitting on two of these for the rest of your life?
Goodness.
Why do people want to do that? Why don't people want to get their butt smaller to fit in? I don't understand that one.
I think it comes down to popular media. You know, you've got celebrities that are known for their bottoms. Kim Kardashian, Beyonce. Jen Selter. There's all these people out there, and that's their calling card. And what happens is people want to look like them, and they undergo these procedures. So instead of implants...
Exercise.
Well, instead of implants, exercise, or you can inject fat. So you take fat from one area, put it into the buttocks. It's a twofer. You lose the saddle bags, and you gain the bottom that you wanted.
And then does the fat in the butt dissipate then after a period of time?
About half of it typically stays.
Perfect.
Much safer.
Thank you so much for your insight. Char, thank you for your sense of humor. More information on Dr. Youn, you can go to dryoun.com. When we come back, Sophie, you're up.